go. What? This baby is not messing around, okay? They have teeth as a newborn baby. Welcome everyone to the channel. My name is Dr. Mo and I'm a dentist. Today I'll review two cases of a newborn baby and a baby who developed teeth within 30 days. And actually there is a difference between something called as natal teeth and something called as neonatal teeth, and explain to you what's the difference, also what's the management in cases like this. This is important for general audience who's interested in this, also for women who are pregnant, expecting a baby, or has a baby with natal or neonatal teeth. So what are natal teeth in the first place? With regard to natal teeth, it's a condition where you have a newborn baby with a tooth already in their mouth. Yes, that can and does happen. Okay, just like what we're seeing here, a literal newborn baby may have a tooth in their mouth, and that is called natal teeth. So natal teeth, these are the teeth that exist inside newborn baby's mouth. Okay, there's also something called as neonatal teeth, which I'm going to discuss a bit later on in the video. Now you may say, cool, so what if a baby has a tooth at a birth? Is that really problematic? Is there any management for this? Like, couldn't they just have the tooth and that's it? No, it can actually be problematic, but not always, okay? Some of the problems that may arise is that this natal tooth may irritate the tongue's baby. That's number one, okay? Because it may have sharp edges that irritate the baby's tongue. The baby doesn't really understand what's going on, so they may be moving their tongue randomly or casually, and hence irritating their tongue. That can be problematic. Number two, as you may know, the newborn baby is going to need breastfeeding from the mother. Okay, so when the mother gets to breastfeed this cute baby, that's great, but also this can be very painful for the mother who's trying to breastfeed the baby that's a newborn. Okay, so it can lead to complications in relation to breastfeeding. Now, there are solutions to this. I think I read something like a shield, or there are other means. Again, we're talking about things from scientific perspective, okay? I'm going to go over neonatal teeth as well, but right now I'm just addressing natal teeth first. So that is another problem may arise. Another issue that may arise is that this natal tooth can be very loose, and this may cause an issue because the baby can actually swallow the natal tooth by mistake if it's too loose or if it dislodges, and this can affect the airway or can cause other issues if it gets dislodged inside the mouth. So there are situations where the dentist or dental healthcare professional may decide, okay, either we will keep the natal tooth, or they may decide the natal tooth may need removal. And if it does need removal, typically that's done if I mean, you can research this, please, but I think about they wait until 10 days at least. Then they may go for that. Let's move on to next case, and that is neonatal teeth. So neonatal teeth is similar situation where you have a baby who developed teeth within 30 days of birth, and the considerations are very similar. This baby can have these neonatal teeth, okay, in the mouth, and they may irritating the tongue, they may causing a lot of problems, or they may not, okay? There's also a likelihood of this neonatal tooth or neonatal teeth to be loose and gets dislodged into the mouth, and the baby may inadvertently, by mistake, swallow them, or a lot of issues may arise. And other considerations also are applicable here in relation to issues in relation to breastfeeding and other problems that needs to be taken into consideration. So TLDR is these neonatal teeth can be problematic. and they need to get checked by a dentist who's knowledgeable in this area, and they need to be addressed, in my opinion, as soon as feasible. Addressed as in getting checked, and also other things like to take the licensed dentist opinion of this and to know what to do next. Okay, everyone, don't forget please to like, share this with your friends who may really benefit from this. Thank you everyone for watching, and peace.